Hello friends, today we'll talk about one very common condition where majority of the people do come to us to treat that condition treated. That's called as melasma. Melasma is the most common pigmentation problem what usually majority of the people they come to us complaining about the typical brownish pigmentation on the face, and it happens later in the age. It's more common after the age group of around 20 to 40 years. And why does this melasma come? See, there are three major factors which has been attributed. One is your genetic factors. There is an inherent tendency to develop that pigmentation. That is the reason it mainly runs in the family. Second is this sun exposure. Why sun exposure is attributed? Because the melasma typically occurs on the sun exposed parts of the body. And what are the sites involved? Typically on the cheeks, the nose, and sometimes the upper lip and the forehead, and rarely the chin area as well. Now, the third common factor is the hormones. Why hormones are involved? Because it's more commonly seen in women. Around 80% of the women are affected compared to only 10 to 20% of the men. And typically there is a tendency to develop pigmentation, especially post-pregnancy, which we call it as chloasma. It's also a kind of melasma, where that pigmentation usually persists, leading to the melasma. Now, let us understand why some of the melasmas improve and why some don't. Because there are three types of melasma which we see. One is the epidermal melasma, wherein the pigment is typically in the epidermis, and here with treatment the pigmentation goes off completely. Whereas the dermal melasma, it is deep inside. It is more of a purplish or a grayish pigmentation, and it is typically ill-defined. This is the most difficult to treat, because the pigmentation is deep inside the dermis. Now the third variant is the mixed melasma, where the pigmentation is both in the epidermis and the dermis. Here almost around some 50% improvement you see. Now then how do I treat this melasma, doctor? I give them a very simple formula. Use a proper depigmenting face wash, a moisturizer, and a sunscreen. And sunscreen has to be minimum 50 plus sunscreen, which gives you sufficient protection, and reapply the sunscreen every 2 to 3 hours. Along with that, a depigmenting cream which may contain the active molecules like hydroquinone, kojic acid, azelaic acid, tretinoin, or a triple combination therapy. And there are a number of other molecules as well. One more thing what I want to tell you all is melasma is not easy to treat. Why? Because it reoccurs very soon. The moment you expose yourself to the unnecessary sunlight, you roam in the sunlight, again the pigmentation comes back. So there is nothing called as permanent cure for melasma, but it is important to take care by using regular sunscreen, avoiding unnecessary sun exposure, and if the pigmentation is too severe, use some depigmenting creams. And if it's still not manageable, and if it's still not coming under control, better take some cosmetic treatments like chemical peel or lasers, which will definitely help. But avoidance of sun exposure is the most important thing.